Good morning, everyone. Hi, Claudia.
Hi,
Hi,
Tiffany.
Alberto. Good morning.
Good morning.
Good morning to you.
Or afternoon in Italy.
Afternoon, actually. You're right.
Yes.
That's right. That's right. Well, thank you all for joining this morning. We are with the International Society for Pediatric Innovation. My name is Tiffany Gear, and I work with these wonderful doctors here. We have Dr. Claudia Hoyen from Rainbow Babies and Dr. Alberto Tosi from Bambino Gesù in Rome. Welcome, everyone. Thanks for letting us join your party. iCAN and iSPI are very close partners, and we love connecting with our patients. So thank you for letting us crash your party today. We are going to talk about what we call mental health in the healthcare field, but how kids are coping. How are you doing? And especially with the pandemic and COVID, we got some wonderful questions from different chapters across the country and world, and we wanted to have a discussion this morning. So I'm going to kick it right off. And this is I'm going to start with this one. Is the medical community aware that kids are dealing with stress and anxiety?
I'll go ahead and start, Alberto, and then we'll give you the second one.
Please.
Great. So again, I just want to echo what Tiffany said. You know, iCAN and iSPI are really good friends. And so we're so happy that you invited us here today. I can tell you as a pediatrician and as a mom, the medical field does realize that kids are dealing with stress. I can't imagine having ever gone through anything like this growing up, like your generation has. And we know you're going through stress, but we also want to tell you that we're really proud of how you're handling it. I mean, it has been an incredibly long 18 months, and we are just so proud of all of you and how you've handled all of the changes, not only to school, but how you have to interact with your friends, how things are just so different for you because you don't get to do the things after school necessarily that you want to do. A lot of your activities have been so different. And even for those of you who have health conditions, the way you got your health care was different. And so pretty much everything in your world has just been turned upside down. I also want to acknowledge if any of you had family members who were sick with COVID, or if you were sick with COVID, or you may have lost someone that you loved with COVID. Those are all really hard things. And we are trying to do our best to help get your world back to normal. And we can use your help. We know that the kids in iCAN are really smart and that they understand a lot about medicine. And so we would ask you and empower you to talk with your friends if they have questions. You guys get healthcare all the time, and you know that we would never recommend anything that wasn't good for you. And so we could use you as ambassadors if your kids have friends. If your friends have questions, you know, tell them to talk to their doctor or talk to their parents about getting the vaccine. Because we want all of you to go back to school this fall, and we want you to have a great fall. And the way that we can do that is by being sure we've protected everybody. And so, as you know, the vaccines are now available for those of you who are older than 12, and the little kids will hopefully fall shortly after this. You know, being that voice of reason for your friends who may not understand, and pointing them to their healthcare provider so that they can get information that's important to keep them safe. We'll be able to get back to normal and hopefully take a little bit of the stress off of all of you. Alberta, is there anything?
Well, and I just want to add here too in the chat that you touched on it, Claudia. One of the kids asked, do you think we'll ever return to normal? You know, back to the mental state we were in prior to the pandemic.
It may be different, but I know it's going to be better. And so we, kind of move through this time, as many of the pieces of our lives that we can put back into place will help us feel better.
Just a couple of words from this side of the world, which is, Italy was a big problem, especially in the first phases of the outbreak of the pandemic, because especially northern Italy was severely hit by the infection, with a lot of deaths among elderly most of the time. So everybody was distracted from this situation in the first phase of the pandemic. And being in a pediatric hospital, we were just wondering what's going to happen right now with our children. We will see a surge of infections also in our hospital. We're a big hospital. We have nearly 700 beds, and we admit more or less 1/3 of the entire population admitted into hospital in our country. Can you imagine what a mess we were expecting to be? But on one hand, we realized very soon that the severity of infection in children was mild. We didn't see much of a problem in most of the children that were admitted into hospital. So at the very beginning, we were partially relaxed. Then we realized that many children were having different problems. And some of these problems were anxiety and other disturbances. And we started recognizing that many of them were coming to the emergency room with unexpected questions. So that was the story in the first phase. And I must tell you that soon we realized that the lockdown and the situation of social distance and the impossibility of meeting other people was really, really tough for our population. Then we had also different signals coming from the schools. During the lockdown, I think we had a strange situation because most of the children had the possibility to interact more frequently and more in depth with the family, which is, not usual. Children are used to live outside and having a lot of activities outside. And on one hand, this was good because the relationships were richer, I would say. In other cases, it was also more difficult because, it was the time when children and parents had most the possibility of discussing their relationship. But at the same time, since children live at home, most of parents do not realize very soon that something is going wrong. That was our lesson. And I was telling you that many of the signals were coming from the schools because teachers were recognizing that their pupils and the students were anxious, they had problems in their relationship, even when they were admitted at school in person. So we then realized very soon that we had to do something, and we set up some hotlines, telephone hotlines, plus some social network also people. Well, I would say places where people with experts trying to help for this kind of situations. And I must tell you another thing that was amazing, because when we tried to support all the children with all these problems, it was fortunately most cases were going the right way. I personally believe that bad times must pass, so I'm convinced that we will get back to the normal with some story that we have been living. But I'm optimistic not only for this because of my experience, but also because what we have been discussing with children was amazing. Um, I remember very clearly the very first day we opened immunizations for children, an open day, and the reaction from them was enthusiastic. So it was nothing comparable to what happens with adults. Children came absolutely immediately with a lot of enthusiasm for getting vaccinated for two simple reasons. They understood that this was crucial for the pandemic, but also they clearly understood that this was the very solution for getting back to normal and meeting again their friends. And second, it was the best way to protect their family, because the responsibility that we have put on our children for being a potential vehicle of infection was really overwhelming. So I must say that we didn't expect that actually immunization was immediately embraced and understood as the best way to go through the pandemic. And I think that this is the right way to go. So we are still dealing with a lot of problems about anxiety, but actually these things are not permanent, I would say. We must have the experience, and we must use the experience to make it better. That's the lesson that we learned. And I think that when you amazing kids in iCAN help us to also understand a little better what's going on, because we as adults sometimes may fail in precisely understanding what's going on, this will be absolutely going for the better, I would say.
A fun fact, apart from being pediatricians, Claudia is an expert in infectious disease. So kids, these questions you're asking are fantastic. And Alberto, who is your boss?
Well, Tiffany is asking me a tough
I know
question, because
it's a fun fact that you always like to say.
yeah,
I mean, not everybody has this boss.
Yes, because our hospital, Bambino Gesù, is owned by the Vatican, and our boss is the Pope. Can you imagine what this means? Because actually every single day we have to listen to the words of this strange boss, I would say. And actually, I bet that you have been listening at the same way to the words he's saying. And he's always encouraging us in doing our work, but also supporting revolutionary ideas. 3 days ago, he was sick. He was admitted in the hospital, and he said, please, remember that universal access to healthcare is extremely important, and make your best to sustain universal care. There was actually something that was not expected, because this kind of models are very difficult to sustain, and we are still practicing universal care with some problems, financial problems. And he was also saying something about the condition of young persons, adolescents, and children during the pandemic. And he was also always optimistic and enthusiastic about the future, I think. This is the atmosphere in which we work all the time.
So I just thought everyone would get a kick out of that, because not everyone can say that the Pope is their boss. So I'm going to ask both of you. I'll start with you, Claudia. Give me 2 tips for these kids. It's not uncommon for all of us these days to encounter somebody who doesn't want to get the vaccine. But we do know that because pandemic is a group effort, what would you advise them as a response? How can we equip them if someone says, oh, the vaccine's not important, or the COVID's not real, and yet many of these kids know how important it is and are evangelists to get that message out. Can you think of some quick responses that they might turn around and reply to those people?
Well, I think the most important thing when you're dealing with somebody who doesn't necessarily believe the same things that you do, and it doesn't necessarily just relate to COVID, is one, you have to be patient with them. I know it's really hard. And trust me, I meet people like this all the time. And I do television interviews and people send in really nasty comments about me. And so I understand that it's really hard. But the thing that you have to do is you have to keep your cool. Because the minute you start arguing with them, they're not going to listen at all. They're just going to dig in their heels and they're just going to shut down. So you have to be patient with them. And I know it's really hard, but if there's a group of kids who can do it, I know it's you guys. The second thing that you need to do is when if you decide that you're going to, maybe just explain how you feel, or things that is to say them kindly. Again, I know it's really hard, but there's the old adage that you you collect more friends with honey than not, and so it's just really important. If you have facts that there are things, if somebody says, oh, COVID isn't real, you can say, well, I follow the data from the CDC, and it is, and people have been sick and some people have died. And you might use the number, the 600,000 is a good number. Another quick thing that you might tell them, because they may say, oh, the vaccine isn't tested, it's not safe. And you can let them know that the vaccine, none of the science was compromised. The reason we were able to get so quickly to the vaccine is that, one, the FDA let them kind of jump over some of the other groups. Every time they would get data, typically what you have to do for the FDA is you wait at the back of the line. But the FDA would just kind of let them go to the front of the line so that they could get to their next step. And the other thing that helped us get this study done so quickly was the fact that so many people had COVID. I mean, I know some of you may have been in clinical trials and you understand that sometimes it takes a long time because you have to get the people to get in the clinical trials and you have to find them and they have to have the right qualifications. Well, as we all know, last year in the fall, a lot of people were sick with COVID. So it didn't take a long time to find those people. So just two quick things that you need to remember for yourself. Be patient and be kind, and let them know that you're following the science.
It's such good advice. I feel the same way. All of us who work in a hospital, sometimes people say, oh, you work in healthcare. And so they ask you all of their questions. And when you have that confrontational exchange, sometimes I find that I take a minute and breathe so that I don't feel reactive, especially if they're coming at me. But also my response has been, I am just so grateful for the scientists that we have a vaccine. Many people don't really appreciate what they have achieved with these vaccines is phenomenal.
Yeah, nothing ever seen in my lifetime. Yeah.
Right. And it's not that it was compromised or fake, or they did all the hard science. And oh my gosh, this is our ticket out of this terrible thing. If we want to go back to school and back to normal. So I try to come from a place of gratitude. It also helps me check my emotions as well.
That's a really great suggestion.
There was another follow-up question that would be really good with this discussion is, why would someone who's had COVID need the vaccine?
Did you want to have Alberto give us a
couple
of quick? Let's get his, and then we can do that one.
I was listening. It was so interesting because actually I'm in the hesitancy business, with no vaccines since I think 30 years.
Yes.
And I know very well how it works. And my first discussion with anti-vaxxers was in the US. It was very strange. It was not in Italy, and it was about the pertussis vaccines. Nothing changed actually, but we keep on thinking that science is similar to ideology, which is not the right thing. At the same time, we learned a lot of things. Science is science. but people like to decide also in the light of their emotions. And that's why sometimes they are wrong, simply because they listen to their emotions instead of looking and watching the numbers, the figures, and the science. So what we can do is listening, because this is what happens also in the office when you have some people that refuses to have their children vaccinated. Listening, 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 because sometimes they have a specific questions to be addressed. And sometimes they don't recognize some simple facts that we can offer, but and this is something that we do all the times. And I must tell you that also the role of social networks that we have emphasized so much in the past, it was not that important for COVID-19. That was amazing. And we are studying this phenomenon that is really interesting. And I must tell you one more thing. Hesitancy for COVID-19 vaccines is not that big, and mostly is in persons of my age, so in the 60s, which is really strange, because most of the times for other vaccines, we have seen no vaxxers in much younger age groups. That is one of the strange things. But again, Claudia was mentioning patients, which is exactly the right thing to do. Being Zen, when you stay with with the people discussing with you. And I know also of strange discussions and situations where children were willing to be vaccinated and their parents were resisting. And again, ask for help, because you can't fight in the family for things like this, and you need somebody else outside, which is most of the times a pediatrician or a doctor. But Claudia, you may want to go for immunity given by the disease and need of additional vaccine doses, please.
Yeah. Okay. So I think if you take all of our advice about talking to anti-vaxxers, be patient, be kind, listen to them, because they clearly have questions and things that they don't understand. Again, don't get into an argument with anybody. It really isn't worth it, and it won't help change their mind. If you know a couple of quick facts that you can give them, like we've discussed. And probably the best thing that you can do is to ask them to talk to their doctor. Because if we look at the information that we're seeing here in the United States, again, doctors are a really helpful way to help people understand about COVID and the COVID vaccine. And so if you can't think of anything that we told you here, the one thing that you should remember is say, hey, why don't you talk to your doctor? They know a lot about it, and they would be really glad to talk to you about it. And then when we are talking about, somebody who's had COVID, and then the fact that, at least in the United States, and I think probably in Europe as well, Alberto, we're recommending that people still get the vaccine. What we found is a very interesting phenomena, and the thing that we've seen with COVID versus the COVID vaccines is the COVID vaccines tend to generate much, much higher levels of immunity for those people who had natural disease. And so that's why the companies and the regulatory agencies, and you guys know them well, the CDC and the FDA, have recommended that people get it, because everybody feels that looking at the data, that immunity generated by the vaccines seems to be better even than the immunity generated by yourself from COVID.
That's so helpful to know, because there's a lot of information that flies around out there. So
Yep.
Like you said, talk to your doctor. We have 2 doctors here, so it's
Talk to
really
your
wonderful.
doctor.
Yeah, it's wonderful to get those tips. I want to redirect the conversation back to mental health a little bit, because as much as we are talking about COVID and this is all the
Yeah.
source of this anxiety, how can kids cope? Do you have any tips for how to actually cope? What are a few things they could do when feeling really stressed? It might be because of COVID, it might be because of an illness that they have or their home situation, anxiety about going back to school. There's lots of reasons why, but any tips on how to cope?
Alberto, why don't you go first this time? I'm always jumping in ahead of you. So
No problem. Hey, you're great. Absolutely. Well, I would suggest a couple of things. First, stay with others. This is a simple statement, but it is absolutely important to share your thoughts, your experiences with other people, because one of the things that might happen, especially when you are required to pursue social distance and other things, is staying at home alone in your room and so on. I can't forget the very first time that there was a release of lockdown measures, and it was spring in Italy, for example, and I saw a lot of groups of children and adolescents staying together. And the amazing thing was they were not looking at their smartphone, never. This was exactly the single saying, we want to stay with the others and have a social relationship in the classical way. Most of the times you see groups of children and adolescents just looking at their smartphone and trying to play and send messages. They don't do that because they are thirsty of getting back to normal. The other thing is trying to go outside as much as you can, because staying outside is having a relationship with the external things, playing sports, possibly according to the limitations you have and the restrictions you have in your actually situation. But again, the recommendation is tell your story to others, to your parents and to doctors and to your friends, because when you have problems, the others are very happy to listen to you. And especially regarding the role of doctors, I must tell you that our role is listening to you and trying to make our best for trying to find out the best solution. And again, the other recommendation is don't think that this will be permanent. This is an experience. It was a terrible experience, but we will work it out and we will be out of that very, very soon.
Yeah, we were having a discussion at my hospital, how everyone talks about when are we going to get back to normal, where are we going back? And we're trying to change the language that we're going to come through this. We may not be the people we were before this, but that doesn't mean that we're not growing and we can come out of this and be better as well.
Yeah,
so those
exactly.
are really great tips. And I love the idea of getting outside, if it's fresh air, sunshine on your face, and that connection. And one other thing that came up in talking to our kids is everybody knows what telehealth is and they've seen their doctors through video. Isn't it interesting though that when we poll our patients prefer to go back and see their doctor in person if they can, much of the time, because we want that connection.
We are social beings.
Yes. So what
Humans.
about you, Claudia? Do you have any other tips that you would recommend?
Yeah, my theme for this entire pandemic is patience and kindness. And sometimes when you're in a hard situation, you need to have patience and kindness with yourself. Sometimes if you're anxious, you think, oh my gosh, I'm anxious. Oh, I shouldn't be anxious. Why am I anxious? And you spin yourself right into a mess. So sometimes acknowledging that, yep, I am going through a lot and I'm going to get through this. And being patient about it and just working through it, and not getting angry at yourself because you might be feeling anxious or feeling down, and being kind to yourself and taking care of yourself, like Alberto mentioned. Do what you can to be with friends, do what you can to get exercise, meditate, for yourself. these are all things that are really important. But I think the most important thing, I hope that we all learn from this, because we would only hope we're going to learn something good after we've been through all of this, is that we need to be patient and kind with others, but we also, in times when we're feeling down or sad or anxious, need to be patient and kind with ourselves.
No, that's such a good advice. And I think everyone would agree with me that the message here as well is there's nothing wrong with asking for help. It
Nope.
is, we have all had moments where we need support or we need
Yeah.
information. And so we've put up a slide with some tips that we've been covering today, as well as some resources. There's phone numbers to call or places you can text. And please, know that you can always reach out through your iCAN chapter, which is a wonderful way to connect with people. We've got about 2 minutes left, and I'll give
Oh my
the floor
goodness, really?
back. I know it went so fast. So I wanted to give you guys a last opportunity, Dr. Hoyen and Dr. Tosi, to leave us with some final words. I'll start with you, Alberto.
I think, again, that the recommendation to you is be optimistic about the future and be with others. That will be life. And life sometimes offer opportunities and sometimes offer challenges. We are in the, in a phase that will require some patience, but we will work it out, absolutely. And that's our story from the beginning of life, I would say. So
Yeah.
don't be afraid of that.
Wonderful.
Great. What I want to say is kind of echoing what Alberto says. We know we'll get through this. It's, going to be a little bit, it's not going to be tomorrow, but if we're patient and take good care of ourselves, when we get to the other side, things will be okay. The other thing that's really important that my generation wants to say to your generation is, you guys are amazing. Like I said, my generation has never gone through anything like this. And we know that you are all so strong and smart. And we are waiting for us to get through this so that we know you guys can go out there and do what you're ready to do, because you're a pretty amazing group of people. And we're so excited for our future because we have you who've been so strong through this.
Oh, I don't think we can't end on any better words than that. So thank you to iCAN for having us. Again, letting us crash your party this morning. What a wonderful summit. And these resources will be available to you. And we look forward to seeing each other again soon, hopefully live at the next summit next year. So thank you and have a great day, everyone.
Thank
Bye,
you.
guys. Thanks.
Bye-bye.
Bye.
Thanks.